Welcome to The Explainer. Today, we are diving deep into the super critical world of pharmaceutical quality management. We're going to zero in on deviation management, what happens when a process goes off the rails, and how the response can be the difference between a tiny hiccup and a full-blown crisis.
All right, let's just jump right in with a really fundamental question. In a place like a medicine manufacturing plant, where the stakes are incredibly high, is every single error, every little slip up, are they all the same?
And yeah, the answer is a big, resounding no. You probably guessed that. But understanding why they're different is really the cornerstone of a solid quality management system, or QMS. The goal isn't to be perfect. That's impossible. It's all about how you respond when things inevitably aren't perfect. So here's the deal. To handle risk the right way, deviations get sorted into three different types. And this isn't just about putting labels on things. It's a framework that literally dictates every single thing that happens next. First up, you've got your minor deviations. Think of these as the small stuff, things that don't really pose a threat to the patient or the product. A classic example? Maybe some non-critical paperwork gets filled out a little late. It's a blip on the radar, for sure, but it's not a hurricane. Okay, next we step it up a notch to major deviations. Now these are definitely more serious. They've got the potential to actually impact the product's quality or the GMP compliance standards. Let's say an in-process check gets missed, but luckily someone catches it and fixes it before the batch goes any further. It's a real problem, but not a total disaster. And then you have the big one, critical deviations. These are your full-on code red alerts. A critical deviation means there's a direct and immediate danger to a patient's safety, to the medicine's quality, or even to the integrity of the data itself. We're talking about things like using an ingredient that was never approved, or, and this is a huge one, faking or hiding data. And what I love about looking at it this way, side by side, is you can immediately see how the risk just escalates. You go from a simple paperwork delay to a missed step in the process, all the way up to something that could directly harm a patient. It's this kind of clarity that lets quality professionals make those fast, accurate calls when it matters most. So you might be wondering, okay, great, we have these labels. Why does this classification matter so much? Well, it's because it's not just a label, it's a trigger. The category that a deviation gets put into, that kicks off the entire response protocol. And this is exactly how it all plays out. A minor issue, that might just need a quick note in the log. But a critical deviation, that is going to launch a massive, full-scale investigation. This classification decides how deep you have to dig, whether you need a formal corrective and preventative action plan, that's a CAPA, and it all leads to the final million-dollar question. Can this batch of medicine be released? Yes or no?
Look, knowing the types of deviations is half the battle, right? But acting on them correctly, well, that's the whole war. And that brings us to the absolutely essential process of reporting.
If you remember one thing, please make it this. You have to report any deviation the second it is found. There is zero room for waiting around. Any hesitation can turn a problem you could have managed into an absolute regulatory nightmare. Why? Because authorities see late reporting as a huge red flag that your quality system is out of control.
So, what goes into a good report? It's really all about being clear and complete. It has to answer those basic questions, what exactly happened, when and where did it go down, who found it, and what did you do about it right away? This creates that clean, factual record that becomes the launchpad for the whole investigation. All right, so we've talked about how to do it right. Now let's flip that coin over and look at the common mistakes, the traps that auditors find all the time when they're inspecting a company's quality system. These are the recurring issues that can land people in some really hot water. And here they are, the usual suspects, putting a major risk in the minor bucket, reporting things late, or doing a really shallow investigation that doesn't actually figure anything out. But maybe the biggest sin of all is closing a deviation without finding the true root cause. That's like putting a bucket under a leak but never finding out why the pipe burst. It is guaranteed to happen again. When you boil it all down, it comes back to this one core idea. Managing deviations properly isn't about filling out paperwork and checking boxes. It is about actively taking control of your quality system, pointing your resources at the things that are actually risky, and always working to make your processes better to keep patients safe. So I'll leave you with this final thought, the crucial question you should be asking back at your own organization. Think about this framework. How well is your system really telling the difference between the minor hiccups and the truly critical threats? Because answering that question, honestly, is the very first step toward really protecting patient safety.